infection control garb, and I've got my head cover, and I've got a headlamp that I'm going to use, and I'm actually going to put a head cover over this, so when I'm touching it, when I'm doing feet, I'm not getting the headlamp. I'm trying to improve my own infection control. I'm trying to practice what I preach. Not always easy. But, so I've got a head cover, I've got, well, my own glasses, and then the magnifying glasses. Somebody on the comments wrote, she's wearing 2 pairs of glasses. Well, these are magnifiers, and they go over my bifocals. So for me, it gives me double protection for my eyes for flying toenails. I've never had a problem, and I get to see better. But with the headlamp, which I've got on, this is an awesome headlamp. Yeah. And note, I forgot to say this, that eventually we're going to have in the show notes or description or whatever it's called that goes with this, links so that in the near future you will be able to have a source to get everything from what's on my head to the instruments to the drills and the burrs set. So we're working in that direction because everybody's saying, where did you get that? How can I get that? And that's going to be happening sometime in the future. Okay, so I've got my headlamp, I've got my hair cover, I've got my magnifying glasses. This is an infection control gown that I've got over my lab coat that I'm wearing. And then I've got gloves in here, and I've got little OR shoe covers so we can throw those off at the end of the day. So I'll just grab stuff and tell you, okay, so I don't soak feet. And this is very controversial. People do or don't, or want to soak or don't want to soak. This is my thoughts on soaking. Most of the people I see have impaired in circulation. They're older, they have peripheral vascular disease or arterial disease if they're smokers, or diabetes. So soaking is not a good thing, especially in hot water and especially for any long period of time. But more importantly, when you're drilling or filing, you need a dry surface. And the reason you need a dry surface is so that you can see where the callus ends and the tissue is, and if you soak it, it's all mush, and it's just not effective. So yes, sometimes the feet are dirty, and I have stuff to do, kind of what I call a spit shine, not very professional, but I clean off the surface dirt as well as I can. I file them, do their feet, and then what we're going to try to do is have a foot cleaning place afterwards, or maybe somewhere down the road. No, I don't think I'm ever going to do soaks. Okay, another thing about soaking. So if you do want to do soaks, do it afterwards and ask the patient if they want it. Some of them may not even want it. And use tub liners. There is a way that you can use hard surface disinfectants on, where is one? But, okay, like this, if you spray it on a tub, you have to get every single nano section of the tub. And this is very expensive, and it's caustic. So, and it has to sit for a certain amount of time. So it really takes a lot of time, energy, caustic stuff, expense to do it that way. Tub liners, I don't know, you can get them fairly cheap in bulk if you're gonna soak, and then you throw them away in between, and then you're good.
Environmentally unfriendly.
Yeah, no, it's like that. But it also, we have to do it to maintain infection control. And then I've just got these travel wipes again to just clean off the surface. I have found puppy pads are the cheapest, easiest things. This is what I put people's feet, I'm gonna turn this lamp on. Okay, I put people's feet in my lap on this. And then they have these things, they call them pody pads. And some of the places have cute foot designs on them and stuff. And I kind of put them off, I usually put them to the right because I'm right-handed, as a little mayo stand or clean area. And then, let's see, this is Microcin, and I want to thank Sonoma Pharmaceuticals, who are generously supplying us with tons of samples and products, and they're wonderful. And this stuff I spray on the feet after they're done because it kills everything. And if I have kind of cross-contaminated by touching my headlamp or my phone, I've been known to do such things. This makes me feel better when I spray their feet. Everything's, been killed. And then I also spray off everything in between patients, etc. So that's the Microcin by Sonoma Pharmaceuticals.